All right, in this video, we're going to go over a full arch case, in this case, verification jigs, and full arch prototypes that we're doing for the initial try-in. We've got the upper arch and lower arch, and they are going to be opposing each other. We just did a really quick staining and glazing on these. They're going to be full arch zirconia cases here, and this is an interesting case because we actually got the scans from the doctor that were not aligned using a scan verification jig yet. We are going to be using the MUA Rosen screws for this case, and the doctor is going to try these prototypes in. It's going to try the upper in, and that should be pretty close to where it needs to be. Where we'd merge the scans up with that, no problem. The lower, we weren't able to 100% get the scans lined up, so what we're going to do is going to take a scan of the upper lower bite in occlusion, and then we know that the occlusion is going to be slightly open, something like that, or it might be a little bit askew, and then the doctor is going to take a scan of that bite right there. And that's going to allow us to merge the tissue scan to the lower arch prototype, which is going to give us our implant positions, kind of working our way backwards here. And then at that point, we're going to go ahead and use our verification jigs to create some verified models. We've got the upper arch here. Going to place the Rosen screws inside the upper arch, and then once they're all seated in there, we're going to go ahead and flow some resin or composite in between the different sections here. This is a free floating section, so they're going to be flexible and they'll be able to move a little bit. And so once all those sections are closed up, then what we can do is fabricate a verified model. So yeah, as you can see there, each section is independent of each other. And then we have these holes both in the buccal and the lingual / palatal built in. That way, some resin can be flowed in there either through a monojet or just the injectable resins that are used for temporary materials, for temporary crowns. Then at that point, we're going to go ahead and do that same thing for the lower arch after the upper is completed. And we don't need a scan of the verification jigs, but we do need a scan, as we mentioned, for the prototypes. Now we do have the upper arch completed. Once we get that done, we're going to go ahead and move on to the lower arch. Same concept here. Each section is independent of each other. And then once they're all luted together, we can go ahead and remove those. Those will get shipped back to the lab. Patient can wear those prototypes if they're fitting great. If the prototypes are not closed, then they can use their current temps. And this is the verified model we're going to make once we get those verification jigs back to our lab. That's it for this video. Thank you. Video.